VODI is a network of safety net providers, health departments, healthcare systems, community service organizations, and academic institutions in Detroit.
Impact is an initiative of VODI to extend our roots and our branches out into the community to address additional disparities in health, not only access, but the issues of disparities related to diabetes and hypertension.
Our community assessment was very important because it told us what the community wanted and needed. They wanted intergenerational activities. They had a need for good information on diabetes and high blood pressure. They wanted information on how to live healthy and program activities to be fun.
VODI, through its Impact Healthy Living program, actually gives people the tools and the resources to teach people that deal with diabetes and deal with high blood pressure and other issues how to deal with these things. And it's right there in the community, right in their reach.
VODI Impact is a healthy living campus located in the heart of the Osborne-Connor Creek communities. The campus is home to several community organizations, 2 senior housing facilities, and borders the Millbank Greenway. It brings previously unavailable health services and education to those communities in a safe location. We call it the Hub.
There were lots of resources that were available to the community, but perhaps not being used by the community and were unknown to the community.
Impact is a healthy living campus, and it's a comprehensive approach to healthy living that's made possible by our strategic collaborations with partners. They all specialize in addressing the key influencers on diabetes and hypertension and management and prevention of both.
My doctor indicated to me that my sugar levels were high and that I was pre-diabetic. I want this to change.
I joined Impact because I am a diabetic and I really needed to learn how to eat healthier.
When my doctor told me I was a diabetic, I was in shock. I didn't know what to do or where to go. I had all these questions that ran through my mind, so my clinic referred me to Impact.
We're really focused on the medical side of keeping people healthy. And so we have not traditionally gotten into the fresh fruits and vegetables and the exercise, though we're constantly telling our patients about it. And so to be able to refer patients to the Impact program has been really great.
Impact took me by the hand and saved my life.
This is a happy group of people. They have fun together, they meet new people, they learn new things together, they provide support for each other, and we don't focus on negative issues with them. We allow them to be excited about learning new things for life. Our programming effort focused on 5 key areas: education, fitness, fresh foods, access to health care and health services, and personal safety.
We used a lot of different strategies to provide health education and health information here in the Connor Creek community. Our overall philosophy in health education was, I learn from you and you learn from me. Impact relied very heavily on its partners in helping to provide health education and information. That's the core of the model of Impact, where we're the communication vehicle for the community, but it's our partners that really offer the services.
We meet with the people and have the opportunity through conversation, which our program is designed, to hear from them what is most pressing for them at this time for their health needs.
The Impact program served as a teaching and research partner for a number of universities.
The students are learning that there's a lot more to hypertension than your exercise and your diet and your medication. It's also about what's going on in your life.
VODI Impact works closely with health providers and health systems. Impact connects members to providers and has received over 200 referrals from those providers.
For us, the biggest thing has been the confidence that patients develop as being a part of VODI. They get to be their own advocates.
What we tried to do were design programs that were fun and that people wanted to engage in. The key was meeting people where they were, tailoring a exercise or fitness program around them, and then educating them on the benefits. We understand that stress is also a big contributing factor to health outcome.
I really was just coming just to get a little bit of exercise, but needless to say, I really got hooked and addicted to it. So I come 3 days a week now.
The Kidney Foundation actually runs a program called Enhanced Fitness, which is a national evidence-based fitness program. Impact was looking for a fitness program that kind of topped off everything else that they do, because they do everything. And it was literally the right place, the right time, and that's how we kind of merged forces.
The nutrition education portion of the Impact program is really probably one of the most important pieces of access to healthy food. It's not only just teaching people what healthy food is, but it's also helping them to understand the impact that that food is having on their bodies.
We started talking just in class about how to preserve our food. I said, well, we were talking, well, why can't we do a canning class? So from that, we started doing some vegetables, and then we started doing some actual classes.
Voice It is the combination of conversations about diabetes, about cooking, and then we throw in photography.
It's a new experience because many of the things that she teaches us about, we've never heard before, and she gives us the opportunity to try new things.
As the community becomes stronger, they feel more empowered. So they look out for each other, and there's something that they value about each other. That's really what a healthy community is all about.
The students coming here today, working with the seniors, interchanging with the seniors, getting a little excitement going, a little vibe going. I think it's good for both the seniors here at the complex and the students over at the school.
They showed that they cared about you. And that was more important too, to feel needed, to feel the warmth, and that you absolutely accepted. And when you don't have anything, which is me, that's the most important thing a program can give you.
Impact from walking to cooking to just talking and having conversations about diabetes, it just makes you more aware, and it lets you know that you're not in this alone.
Eating healthy is important to me because I want to share this with my family and all of my friends, and I want to live for as long as I can because I have to find me a husband.
For many, many decades, patients came and we talked to them, or we talked down to them. Now, with them being empowered, then they come and they stop that physician. You're not going to just sit here, turn your back to me, and write a script. I've got a list of questions. I brought them, they're relevant, and I need you to give me answers. And for providers, that makes us better.